How's it going, guys? Before I start this video, please like and subscribe. So today's shout out goes out to Billy Crims. And if you would like to get a chance for a shout out, then don't forget to like and subscribe. And in my next video, I'll be choosing a new subscriber. So today I'll be showing you how I do my JP drain wound care, and also I'll be explaining why I have it and also the purpose of it. So without further ado, let's begin. So I wanted to make this video before they take out the JP drain, and the reason why I have this is because after surgery there's going to be a continuous amount of fluid discharge at the surgical site. So the JP drain helps remove any excess fluid and also helps speed up the recovery process, and it's almost like a wound vac if you think of it, but the only difference is you're not hooked up to a huge machine. So the JP drain works as long as it's fully compressed. If not, it won't have any suction. So the JP drain should be drained as frequently as possible, and also they'll remove it once they notice there's barely any fluid discharge. And also once they do remove it, swelling and also fluid can accumulate at the surgical site, so you gotta pay attention to stuff like that. And if you do get any swelling or have any fever, then you should let your doctor know. So when I had a high fever, I thought it was because of the rain, and so I ended up being admitted at the hospital, and they ended up CAT scanning me and they found fluid beneath my flap. So they had to surgically drain it, and also they had to clean inside where the flap was, and then they had to restitch it. But also in most cases you could just get an aspiration done. So what an aspiration is, they'll stick a long needle about this long in an affected area. They'll inject out any fluid that's there, and then they'll test it and see what kind of bacteria you have. And most cases you could just be on oral antibiotics or an IV. And then luckily this time I didn't need to go on PICC because that's very painful. It's a long needle that goes right here all the way to your chest. So now I'm gonna be showing you how I changed my bandages and also how I drain the JP drain. So let's begin. So it's always important to wear gloves so your wound doesn't get infected. So what I need to do is I need to cut the bandages off, and how I do that is I use medical scissors. And if you don't have that, then you can use regular scissors. But something to keep in mind is you gotta be careful that you don't cut yourself or also the tube. So what I need to do is make sure it's pulled far away from my skin, and also make sure the tube isn't in the way or you could cut it. Now I just need to take this off, and how I do that is I pull this off of my skin, and all it is just a 4x4 slit in the middle so it can wrap around this. And I can't cut it with these since they're kind of like safety scissors, so I need to flip it around so I could poke it in the middle, and always start from inside out because like I said, you don't want to cut the tube. And if you want, you can ask your doctor to cut this a bit so it's not as long, so it's not hanging as much on your leg. And like I said, it's very important not to cut these when you're cutting off your bandages, and it's very important to always make sure that there's enough room between the scissors and this. So I was lucky to at least have enough so I could still put it on there, because I still need this to drain out any fluids. So now what I need to do is I need to clean it. I'm going to be using like these 4x4s, and so this is what it looks like. And what you're going to do is you're going to clean all around here. And this is surgically intact. They use a blue string to do that. Then what I need to do next, I need to put on these 4x4 bandages. And so what I do with these, I just cut it halfway. Just like that, so the tube can go between it. So what I need to do next is this way, I need to flip it to the other side so it overlaps it, so this can be closed. And you can just use tape, it doesn't matter, but I prefer using two bandages. And I'm not done yet. I need to at least wrap this, and I like using cold bands to wrap it around to make sure that this is secure and that it doesn't pop off or the bandage is coming off. And I prefer using the paper tape versus the plastic ones because the paper tape, I feel it sticks better. So I need to put the cold band on before I put the tape on, because tape can rip off your hair and also your skin. And you can do this on your bed, but for demonstration purposes, I'll be doing this in my wheelchair. And when you're doing this in your wheelchair, it's best to at least like scoot back and then put it under versus over. Find the right length first before cutting it. And try to slide it in place to make sure it's level to the bandage before wrapping. Just like that. And what I need to do next, I need to tape it to make sure it doesn't unroll. And so this is what it's going to look like. You see it holds the bandages in place, and you could just tape it where it ends, but I prefer just wrapping it all around to make sure it's secure. And what I need to do next is I need to drain this. And so of course to drain this, you gotta pull off the cap, and then you also gotta keep it squeezed to hold its suction before putting the cap back on. And so this is what it looks like. It's very nasty. And your doctor wants to measure the outcome. And the reason why is because they want to see if the JP drain should be removed or should stay in longer. And so on here, it has at least like numbers. And so this is at least like 20 ml. And also it has numbers right on here. And then I'll be showing you how I dispose of this at the end of the video. And if your thing was longer, what you'll do is you'll have it like this. I wouldn't recommend rolling it up before taping it to your leg, because the more twines there is, it could get kinked. So I'll just do it one time. And so it's just going to be like this. And then I would put the coat band right here, but I don't have that. But I still need to put this to my leg so this doesn't pop off, which does all the time when I be transferring like this. And when it does that, what you got to do is you got to put it on. And how you put it back on is you got to open this like that and then squeeze it, put it back on like that, and then still squeeze it and then put the tube back on. And then you just gotta tape this to make sure that this doesn't fall off. So I'm just going to use a coat band to put it on. Like I said, it's easier from going underneath than over, especially if you're sitting in a chair like me. Then what I gotta do is I gotta tape it, and I'll just do this real lightly so it could still be able to expand. And so this is what it's gonna look like, and of course it's still gonna be able to expand like this. You just gotta squeeze it and then put it back on. And so what I need to do next, I need to clean my incision. And what they use is the same thing. They'll be using blue fishing wire, and I think they just use it just in like the harder areas to heal. And then the other ones, like from right here, all right here, it was actually dissolvable. And since this bandage isn't as big enough, what I need to do is I need to put it in diamond shape. And the reason why is because it has more surface area this way versus this way, because it's more shorter. And so what I need to do next, I need to dispose of this. I'll be showing you how I do that. So that's how I do my wound care for the JP drain. And if you have any questions, then I'll recommend asking the surgeons or the doctor at the hospital. So they'll explain more about how to take care of it at home for you. And so I'd like to mention that unlike my first surgery, when they did the flap, they said that I didn't need to add any Aquaphor or anything like that, at least like for a couple of weeks, because brown bandages has enough moisture as is. And so I made a video right here explaining about how it traps moisture and it's actually bad, but in some cases it could be good. So anyways, if this video was entertaining or educational, then don't forget to like, subscribe. Until next time, bye.